many women who come to see me are in that menopausal or perimenopausal stage of life when they are noticing that their shoulder doesn't move the way that it used to. Issues that get exacerbated by the hormonal changes you're experiencing. So loss of estrogen can mean stiffer, achier joints, especially in that shoulder and the hips. There are things you can do right now to ease this discomfort and even prevent further joint issues. Today, we're tackling something so many women experience but rarely talk about openly: menopause and musculoskeletal pain. Menopause is often associated with hot flashes and sleepless nights, but did you know that more than half of all women also experience increased joint and muscle pain during this life stage? Here's what's going on inside your body. As you approach menopause, estrogen levels, particularly estradiol, the active form, begin to decline. Estradiol is crucial because it has anti-inflammatory properties and helps maintain strong bones and muscles. So as those levels drop, your joints may start to feel that impact. But here's the good news. There are things you can do right now to ease this discomfort and even prevent further joint issues. Let's start by understanding what's really behind this joint pain. Some common causes, including conditions like osteoarthritis, rheumatoid arthritis, fibromyalgia, and osteoporosis. Osteoarthritis often manifests as joint soreness that improves slightly with movement throughout the day, whereas rheumatoid arthritis typically involves stiffness and swelling that persists longer, especially in the morning. Fibromyalgia is a condition characterized by widespread pain throughout your muscles, ligaments, and tendons, often accompanied by severe fatigue and sleep disturbances. This condition can be especially challenging because it's not always straightforward to diagnose and can overlap with other menopausal symptoms. And then there's osteoporosis. This condition means your bones become less dense and more prone to fractures. This drop in estrogen accelerates the bone loss, especially affecting critical weight-bearing joints like your hips and your spine, making everyday activities more challenging and painful. Many women of this age group also ask me specifically about shoulder and hip pain and stiffness during menopause. You've probably heard of frozen shoulder, and it's no surprise that many women who come to see me are in that menopausal or perimenopausal stage of life when they are noticing that their shoulder doesn't move the way that it used to. It has pain, it has stiffness, they can't do the things that they used to do. Often this can be due to conditions like adhesive capsulitis or frozen shoulder, bursitis, tendinitis, or osteoarthritis. Issues that get exacerbated by the hormonal changes you're experiencing. Estrogen helps lubricate your joints, support that bone density, and keeps tendons flexible. So loss of estrogen can mean stiffer, achier joints, especially in that shoulder and the hips. Another important factor to consider is posture and gait. Menopause-related muscle and bone weakening can subtly change how you walk, sit, or stand, placing extra strain on your hips and your lower back. Over time, this can lead to chronic pain issues that feel unrelated but are deeply interconnected. So what can you do about it? First, movement truly is essential. Motion is lotion. Exercise might sound counterintuitive when you're in pain, but staying active is so essential. I tell my patients all the time that you cannot be sedentary when you're in pain. If you do that, it's a terrible circular cycle where you will still be in pain and continue that pain. If you move the joint, even though it's a little painful at the beginning, with time, you're going to have less pain. Resistance training specifically is fantastic because it strengthens the muscles around your joint, which reduces stress on the joints themselves. People often with knee pain, I'll tell them, if you strengthen that quadricep and that posterior chain, it will actually lift the kneecap and help reduce the stress on the joint. Here are some practical, simple exercises you can incorporate into your daily routine. I love body squats. You can plant the foot on the ground, so you're doing an isometric exercise. You're not giving any extra strain to that quadricep or your kneecap. I also love lunges because they're also an isometric movement. That means your foot is planted to the ground. It's not hanging off into space, putting stress on the quadricep or the knee. I love push-ups. You can do modified on your knees, but it's great for your core, it's great for your chest and your arms. Dumbbell rows are another great exercise, and gentle overhead presses and leg presses if you have a gym pass. Now, while strength training is key, adding low-impact exercises like swimming, cycling, or brisk walking can also significantly improve joint mobility and reduce inflammation. It's a bit counterintuitive, but you actually don't want to do a lot of HIIT training or really high-intensity exercises because that will raise your cortisol, and when you're in those perimenopausal years, you really don't want that. So the activities like swimming and low-impact exercises, they're going to keep your joints lubricated and flexible without putting excessive stress on them. You also want to make sure you are incorporating core training and mobility work as well. Nutrition is another powerful tool to manage the joint pain and inflammation. Think about incorporating foods rich in omega-3s like fatty fish, chia seeds, and walnuts. Adding more fruits and vegetables, especially berries and leafy greens, helps combat inflammation naturally. You might also explore soy-based products like tofu or edamame, which contain isoflavones that gently mimic estrogen's effects. You may want to not take dairy or meat because those things can also be very inflammatory to the joints. At the same time, cutting back on foods that trigger inflammation, like saturated fats, sugars, refined carbs, and alcohol, can make a noticeable difference. Being mindful of hydration is also crucial. Staying hydrated supports that joint lubrication and overall cellular health, enhancing your body's ability to manage all that inflammation. Let's not overlook some lifestyle changes. Aiming for even moderate weight loss, just 10%, can significantly ease knee pain and improve mobility. I've had my own patients that are able to combat needing a knee replacement or a hip replacement due to osteoarthritis in those perimenopausal years just by reducing their weight. Their x-rays haven't changed at all. Everything looks the same, but that minimal weight on the joints makes it so they don't need a knee replacement. Weight loss not only alleviates joint pressure, but can also dramatically improve overall health, reducing risks for other chronic diseases like diabetes and cardiovascular issues. When it comes to medications and supplements, options like ibuprofen or topical anti-inflammatories can be helpful in the short term. For long-term relief, you really want to look into hormone replacement therapy. It's been shown to significantly reduce joint pain in many women. Supplements like turmeric, collagen, omega-3 fatty acids, calcium, and vitamin D can also provide that additional support. I also really love giving your joints and tendons a boost with platelet-rich plasma, or what we call PRP. Don't underestimate physical therapy either. A skilled physical therapist can tailor exercises to your specific needs, improving strength, flexibility, and even balance. This is essential as we age. Physical therapists can also teach you proper body mechanics and posture, preventing future joint injuries. Lastly, alternative therapies. I love these, like massage, acupuncture, even cognitive behavioral therapy can really complement traditional treatments by addressing the physical and emotional aspects of this chronic pain and this new stage of your life. Remember, menopausal-related joint pain doesn't have to be permanent. With proactive measures, exercise, dietary changes, smart supplementation, and personalized medical guidance, you can regain control, move better, and feel stronger. You deserve to thrive, not just survive through menopause and beyond. Let's commit today to these steps and build resilience together. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.